Hi again, it's Dr. Robert Strang, Chief Medical Officer of Health. So again today we're announcing 13 new cases of COVID-19, bringing the number of confirmed cases in Nova Scotia to 41. Like the other cases, these ones are either travel-related or related to close contact with earlier reported cases. One of our new cases is a child. That means that the 41 individuals affected range from under 10 to mid-70s. We have cases in communities across the province. Fortunately, all but one of the individuals remain well enough and they can be at home and remain isolated at home and are recovering. We have one individual who's in hospital. The fact that we're seeing an increase in cases actually is what we actually expected to see as we enter into COVID-19 here in Nova Scotia. We knew we were going to get more travel-related cases as people came back to Nova Scotia and been in other parts of the world where there's an increasing likelihood of exposure. The fact that with public health, every case we do close follow-up, so we talk to the case, identify when they became sick, who they were in close contact with at the time when they became sick, and since then until they were tested positive. In all our cases, they've had very limited close contacts. That's really good. That's what we want to have happen. People coming back to the province, isolating themselves right away, going through 811 if they get symptoms rather than just going into the doctor's office or the emergency department. And then we bring them in for testing in a very controlled manner, and then we get them back home. What people are doing and what we're doing once they become sick, it minimizes the chance of other Nova Scotians become exposed. So in all of our cases, we have a very small number, sometimes only just one, of people who are in the same household. And that's what we need to do. That's why it's so important that people coming from anywhere outside of Nova Scotia now go home as soon as they get into the province. Don't stop and go shopping. Don't visit family or friends. Go home and self-isolate for those 14 days. Because if you do become sick, if you do that and stick to it for 14 days, you limit the chance for this virus to spread to others within Nova Scotia. My main message is that the fact that we're seeing cases that like we are tells us what we're doing is working. And if we all continue to do this and the personal protective measures and following the social distancing and the mass gatherings and the requirement of self-isolation if you've traveled, all that together, if we all do it and do it well, it will work. It won't completely remove COVID-19, but it will minimize the impact and the spread of COVID-19, will substantively protect Nova Scotians, especially our most vulnerable, and will preserve our healthcare system.